Mater Hospital welcomes you to its newest satellite medical center at the Well Mall along Langata Road in Karen.
The reason why clients should come to Mater Karen Clinic or Medical Center is because we offer a variety of medical services, to include consultation services which are done by our qualified and experienced doctors.
We manifest the Spirit of Christ in the provision of healthcare to all our patients as we adhere to the values of the Religious Sisters of Mercy.
We provide basically primary healthcare services. So this means we'll follow up patients on an outpatient basis for various diseases, including diabetes, asthma, and any other illness which arises, which does not require complex care. Our staff are qualified and provide effective services which are cost effective and good for our patients.
The various services that we offer at our clinic include pharmacy services, where we have a fully stocked pharmacy run by a qualified pharmacist, and we serve all your prescription needs. We have laboratory services that are run by our qualified lab technologists.
Get more than just basic treatment at Mater Hospital Karen Medical Clinic.
One of the key features of primary care is that we provide health education about various conditions. This would include things like hypertension. We would advise you on things such as how to take care of your health.
We serve our clients within a very short time. We have enough well-ventilated waiting area for our clients, and we have rooms for all those procedures that we've mentioned, well-spaced rooms with enough facilities and equipment. We also have all the decentralized services that are offered from the main hospital, to include ultrasound services that we offer on Wednesdays from 8 a.m. to 5 p.m. in the evening. So feel welcome to Mater Misericordiae Hospital, Karen Medical Center.
We take pride in your wholesome well-being. We are always ready to meet you at your point of need.
A lot of health issues are now preventable, and this means that just by making lifestyle changes, we can improve the health of people in the community.
Our esteemed clients and patients, welcome to the Mater Misericordiae Hospital, Karen Medical Center.
We have a large, well-ventilated facility, which means that we are able to see patients in a safe environment. And I would ask you, if you have a health issue and you are within the area, please feel free to come and consult us. We're happy to work with you and identify your issue and resolve it.
We are open every Monday to Friday from 8 a.m. to 7 p.m. and every Saturday from 8 a.m. to 5 p.m.
You come and support us in this medical clinic in Karen, in the Well. We are in the first floor, and you just test us. Sisters of Mercy are known for quality because they are all over the world, and especially our care for the sick. It is hard times because of the coronavirus, but we know we will give the best quality.
We just want to welcome all of you to come to our gynae clinic. It runs every Tuesday from 9 to midday. We have the full gynae specialty, all located in one room, one roof. We have a very comprehensive lab. We have ultrasound services, and most of all, we have caring staff who are going to take care of all your needs. So once again, welcome and karibu to this great medical center of ours.
Welcome to Mater Misericordiae Hospital, Buru Buru Clinic for holistic medical services.
This is Buru Buru Medical Center, which is part of Mater Hospital. And at Buru Buru, we essentially offer services offered in Mater Hospital.
We are located in the first floor failing building above Quick Mart. In Buru Buru, we have general consultation Monday to Friday. Saturday and Sunday they are still available. We still have specialists. On Tuesday and Thursday we have our gynecology clinics running from 8 a.m. to 2 p.m. We have a pediatrician clinic running on Wednesday at 8 a.m. to 2 p.m. We normally have a wellness, which we normally do from Monday to Sunday. Every day, feel welcome, you can come.
Experience the difference in our wide range of quality, responsive and compassionate healthcare services.
We have very highly skilled and qualified staff running the units. We offer services including doctor's consultation services, which is a general doctor in the outpatient unit. We also have laboratory services and pharmacy services. On particular days of the week, we have specialized clinics, which include the physician clinic, where we have our hypertension and diabetes patients followed up. And then we also have the obstetric gynecology clinic, which is run on Tuesdays and on Thursdays. We have the pediatric clinic, which is run on Wednesdays. And then we also have the ENT clinic, where we have the ENT doctor coming in, and that is run on Fridays in the morning. There is also a pediatric surgery clinic, which is also on Fridays.
Our child welfare, we normally do them on Wednesday, Friday, and Saturday from 8 a.m. to 2 p.m. We have our ENT clinic Friday, 8 a.m. to 10 a.m. We normally have nutrition services on Tuesday to Thursday, and we have extended our radiology services from Monday to Friday to Saturday nowadays. Initially, we were running up to Friday, but currently going up to Saturday.
We deliver all our services with utmost diligence, integrity, and equality.
We see everyone at the Buru Buru branch. We do not discriminate against anyone, either on race, on religious grounds, or disabled people. You are all welcome to receive services at our branch.
Be assured of privacy. We normally keep to our ethics. We are so compassionate to our clients. Integrity is all over. So when you come, we feel you, and that is why you can see nowadays we are running, like every Friday we are having a special clinic. Currently we are running the breast clinic. Next month we are coming up with clear colon screening. So don't forget we are Christ-centered. When you come, and we don't segregate because you are a Christian or a Muslim or Hindu. We treat every client as equal as any other.
Catherine Macaulay Nursing School is a leading institution in Kenya offering competitive training in nursing education, innovation, research and professionalism.
We are a nursing school that was started way back in 1972, chartered as a midwifery school. The school is run by a highly qualified faculty. All the departments, for example, you look at midwifery, it's headed by someone with a PhD in midwifery. Critical care is headed by a highly specialized person with a master's in critical care. Nephrology, the same. Our clinical instructors for these programs are also specialized in their various fields.
The school is licensed and accredited by the Nursing Council of Kenya to offer holistic training in various nursing programs.
We have general nursing, that is the Kenya registered nurse. We have higher diplomas in Kenya registered midwifery, Kenya registered critical care nurses, Kenya registered nephrology nurse, and also we have theatre nursing, which is called Kenya registered perioperative nursing. We do admit our students from all over the country, especially for the basic diploma, that is the Kenya registered nurse program. And for higher diplomas, we admit, again, we have a Pan-African presence. We have students from Congo, from Rwanda, from Uganda, and from other countries. But basically, most of our students are Kenyan, those ones who have graduated from our Kenyan institutions.
Enjoy your learning in a friendly environment with adequate training facilities, including a fully fledged skills laboratory, library, lecture halls, and accommodation amenities.
We have good facilities for our training. We have a very well equipped skills laboratory. This is for all the programs, both the basic diploma, the Kenya Registered Nursing, the midwifery, the critical care.
Nursing is a noble profession because we work with our clients at different stages of their lives, right from birth up to end of life. When a baby is born, a nurse is present. When a baby is brought to receive vaccines, a nurse is present. When you fall ill, the nurse is by your side. And even at the end of life, a nurse is present. So we are there to give our services throughout each stages of human life.
For more information, call us on 0732 163 164 or 0719 073 164 or visit our website at www.matakenya.com. Welcome to Misericordiae Hospital, Nairobi CBD Medical Center.
Development House Medical Center was opened about slightly above 10 years ago, and since then we've been providing ambulatory care to clients who come to us. The clinic is located between Tomboya Street and Moi Avenue, right opposite the Pioneer Building.
We guarantee our patients quality standards and variety of medical services.
At Development House Town Clinic, we have the following services. We offer doctor's consultation. We also offer physician services on Mondays and Fridays, obstetric and gynecology services on Wednesdays and Saturdays, nutritional services on Fridays. We also have a well-equipped pharmacy, a well-equipped laboratory. We have physiotherapists, and we also have just begun our wellness services as a way of encouraging preventive medicine.
We provide specialized services, that is gynecology and antenatal clinics. We provide services to the diabetics and the hypertensive patients. We give nursing services. We will do your dressing, we give you injections, we also provide some counseling services. We have specialized counselors that would give you natural family planning counseling and guidance, and you'd also get the general counseling. We also provide adult immunization, and basically for adults who want to travel, we are able to give you the vaccines that you need.
We uphold the dignity and privacy of our patients as we strive to meet your healthcare needs holistically and in a more compassionate way.
The service that you'd receive at our medical center is a value with a touch of Christ. We do not just want you to be taken care of physically, but you also think about your spiritual care and spiritual growth.
Visit us every Monday to Friday from 8 a.m. to 6:30 p.m. and every Saturday from 9 a.m. to 3:30 p.m. and get value for your money.
We ensure that you're seen within the shortest time possible, however, providing quality care.
I welcome you all to Mater Hospital CBD. We assure you of timely, efficient, and satisfactory services.
A very warm good morning, and thank you so much for making time for this live discourse brought to you by Capuchin TV in partnership with Mater Misericordiae Hospital. Remember, they say that the greatest asset that a country can ever have is a healthy citizen, and it is in this respect that we bring you these weekly discussions on health, just to equip you with the information and healthy practices so that you can live a healthy life. So my name is Sasha Elizabeth, and I'm joined by a beautiful medic from Mater Hospital. Allow me to give her a few seconds to introduce herself before we proceed.
Yes, hello Elizabeth.
Hello.
My name is Dr. Elizabeth Waroy from Mater Hospital. I'm based at the Karen branch, which is at the Well. And thank you so much for having me here.
Thank you very much for creating time for this.
Yes.
Great, so that's her, my namesake, so the two Elizabeths or Elizabeth squares, whichever way that works best for you. So welcome, and remember, as usual, we value your feedback, and we are always ready to respond to your questions the best way we can. So direct your questions to 0717424866. You can also drop your comments and concerns on our social media platforms. We are live on YouTube, Facebook, and a link is shared on Twitter. The hashtag to use is health discourse, hashtag Capuchin TV, hashtag Sasha Elizabeth. So welcome, and let's get started. Welcome once again.
Thank you
so
much.
It's good to have you. The very first time for you to be here.
My very first time.
Thank you for gracing our studios with your presence.
Thank you.
Now, we are set to discuss hypertension. Yeah. What is hypertension, or when is a patient considered to be hypertensive?
So I'll begin by defining hypertension, and I'll use the layman term, which is high blood pressure, and I'll start by defining blood pressure. So blood pressure is the force that a person's blood exerts against the walls of the arteries. Yeah. So now when this pressure is high or when it's elevated, that's what we call high blood pressure, and the medical term of that is hypertension. So we have, it's usually denoted in two values. We have a value known as the systolic and the diastolic. So systolic is the value that is on top, diastolic is the value that is below. So when is someone regarded to have hypertension is when the pressure is above 140/90. So 140 being the systolic and 90 being the diastolic. So we have a range of pressures that within those ranges you're able to know whether you're pre-hypertensive, whether you're normal, or what stage of hypertension you're in. So the normal is 120/80. Or anything between 120 to 129, 80 to 84. That is regarded as normal, or even 110 to 120, and 70 to 80.
So the moment it hits 140,
so the moment it goes high up to 140, 90. So it's usually in ranges. It's not a specific number. So we give it ranges so that at least we give an allowance of people to be able to gauge where they are. So we have pre-hypertension, we have stage 1 hypertension, stage 2, and stage 3. So in a pre-hypertensive state is someone who has a BP of around 130 to 139 and 85 to 90. And then now stage 1 hypertension, now it's from 130 to 149, that is the systolic, and a diastolic of from 85 to 90 or even 90 to 95. And then the stage 2, the stage 3. Stage 3 now, that's where the pressure is quite too high. That is anything above 180 for the systolic and anything above 100 for the diastolic.
No, is this what is considered as hypertensive crisis?
So when you have a hypertensive crisis, we have the medical term is actually hypertensive emergency and a hypertensive urgency. So when you're having a hypertensive urgency, now your pressure is high, but you don't have any symptoms, you don't have any signs, and even the end organ damage is yet to occur. So what happens is someone just walks into a clinic, you get a BP measurement, and you find their pressures are quite high. So you find maybe they're around 160, 90, or even anything above 140, 90. So that is a hypertensive urgency. So it means the pressures are high, no signs and symptoms. So what you have to do is just reduce the pressure. And this most of the time is a patient who's managed as an outpatient. You don't have to admit this patient. A hypertensive emergency, on the other hand, this is something that is quite, it's actually the word emergency explains itself. It's an emergency by itself. So a patient has very high pressures, there's end organ damage. By end organ damage, I mean there's a damage to the kidneys, the heart is involved, the brain could be involved. Yeah, so this most of the time is a patient you want to admit. It's not a patient you'll send home. Yeah, so you try and stabilize the pressures as you try and treat the end organ damage that has occurred.
Thank you very much, Dr. Elizabeth. Now, what is the prevalence rate of hypertension in Kenya and across the globe?
Okay, so first of all, hypertension is quite prevalent in the world today. You find that according to WHO, the statistics say that 1.28 billion people in the world today have hypertension, and it's very unfortunate that the awareness and the treatment levels of these people is very low, and 2/3 of these people are in the middle and low income countries. So 46% of the world population are unaware of the fact that they have hypertension. And in every 5 people you meet, only 1 person is being treated for the hypertension and is well controlled. Because again, there's being in treatment for hypertension, but is the pressure controlled? Yeah, so you find that as much as the prevalence is so high, very few people are, very few people are being able to control these pressures. Yes.
So now, what are some of the causes of high blood pressure in the human body?
Okay, so, when you talk about the causes, it's good now we separate hypertension into 2. So we have primary hypertension and secondary hypertension. Primary hypertension is also what we call essential hypertension, and it accounts for 95% of all types of hypertension that people have. So with primary hypertension, what we have are risk factors, because usually there's no identifiable cause. So when you talk about the risk factors, you have the modifiable risk factors and non-modifiable risk factors. So when you talk of the non-modifiable risk factors, it means that these are things a patient can't control. So they include things like age. So ages above 60s and above. Gender, it's more in males, unfortunately. And then family history and race, it's more in the black people. So when you talk about the modifiable risk factors, so here we have things like tobacco use, alcohol use, physical inactivity, things like smoking, stress. Yeah, so those are the things that you are able to control. Yeah.
So, and why is it coined essential?
Essential really is just a medical term just to show that there's no cause.
Oh, okay.
Yeah, what we call idiopathic. Yes, there's no specific cause. It's just a risk factor that can perpetuate the pressure to go high.
Okay. So now there are some telltale signs. How can someone tell they are getting hypertensive, or in other way, what signs or symptoms are indicative of increased blood pressure in the body?
Okay. So first of all, hypertension in itself is something that never has symptoms. So we call it a silent killer disease. So when you find someone is now actually developing symptoms, this is now someone who has very high BPs, or the pressures are quite too high. So some of the symptoms that one can have are headaches, early morning headaches. You can have blurring of vision. There are those who have nausea and vomiting, confusion, anxiety, muscle tremors. Yeah, so those are some of the symptoms that someone can present with. So once you get such symptoms, blurring of vision, headache, muscle tremors, anxiety, then it's time to actually see your doctor.
Okay.
Yeah.
So now, when you visit a medical facility, usually at the triage, which is mostly the starting point, they have to get your pressure. Is that the reason behind the asymptomatic aspect of the medical condition?
So in a medical setup, triage is usually done to all patients, regardless of whether you're known to have pressure or not. So that's just the first contact with a medical personnel in a hospital. So what we advise people generally to avoid to get to the point of where you're having these symptoms and your pressure is high, do annual checkups. Do annual checkups where you go see your doctor, go to a hospital, and then they'll do a number of tests. They'll do checkups. They'll check your weight, they'll check your height, they'll calculate your BMI, and then they'll tell you the risk that you have of getting hypertension. And even through a physical examination and also the lab test that a doctor will do, they'll be able to assess and tell you that this is what you need to do, or this is what you should stop doing. So ideally, to avoid to avoid getting to a point where you're having those symptoms, just do annual checkups. Yeah.
Thank you very much. Now, does a high BP affect children or the younger population?
Yes, it does. it does affect the pediatric population, and for you to find or for you to discover if you're having high BPs in a child, what usually happens is there are charts by the WHO. Excuse me.
Sorry.
So there are charts that have been made by WHO that normally stratify or categorize pressures in children, and this they're grouped in things called percentiles. So for each age, height and gender of the child, there's a percentile of that BP. So what you have to do is, once you know the age of the child, the height and the gender, you're able to correspond to the required BP of that child. And if you measure the BP and it's not within that range, then you find now that this patient is having high BP. And it's quite important to note that the normal pressure in an adult, that is 120/80, is regarded as high pressure in a child. Yeah, so you use the charts to actually be able to find out what level is too high or too low for a child.
So do you recommend frequent checkups for a child?
So for children, frequent checkups, not really, but now if they have risk factors, that is where now you're able to find, that's when you decide that this is someone who needs checkup. So risk factors like obesity, someone who's physically inactive, if there's family history of hypertension in the family, if there's cardiovascular diseases in the family, someone who suffered a stroke, yes, and the individual risk factors also, maybe that children maybe above teenagers who smoke or take alcohol. So if there are those evident risk factors, then yes, it's important to have an assessment.
Does it mean that if there's a history of hypertension in the family, chances are high that you or some of your children will develop this condition?
That is very true, because it's hereditary. And that's why I mentioned in the risk factors, the non-modifiable family history is a very huge risk factor for high blood pressure. So it's very important to take precautionary measures, knowing that a family member, especially the close family members, have hypertension. Then for you yourself, you need to start taking precautionary measures.
There's this question that one of you had asked, that no one is my family, in my family is hypertensive. How come my BP is high?
Is hypertensive.
He's but hypertensive,
yeah. So risk factors, as I mentioned, are many. So it doesn't always have to be that the risk factor is from the family history. You could find that maybe the child has other risk factors. That is maybe from physical inactivity, the child could be obese, the child could be having, in children specifically, the main cause of hypertension is usually secondary hypertension. Secondary hypertension is now where you're able to have an identifiable cause. The primary or essential, I said, usually you have risk factors. So for secondary hypertension, you have a cause that you're able to identify. So some of these causes include kidney diseases, which are so many, from vascular diseases to parenchymal diseases. So, and the most important cause of high blood pressure in children is usually kidney disease. So it's very important that this child is screened for kidney diseases. Other things that can cause secondary hypertension are hormonal diseases, excuse me, like thyroid disease. You can have drugs, and these drugs include those drugs that are prescribed by your doctor. Things like contraceptives can cause, non-steroidal anti-inflammatory drugs can cause, like diclofenac. And then now you have the non-prescribed or the psychoactive or recreational drugs like amphetamines, cocaine, and all those. Yeah, so those are some of the secondary causes. And then you find that when you're able to identify a cause, whatever it is that is causing the high blood pressure, you're able to treat that cause and the pressure will come down. Yeah.
Thank you very much. Now let's talk or hear a little bit about hypertension in pregnancy. What factors predispose an expectant woman to hypertension or high blood pressure
in pregnancy? So that's what we call preeclampsia, and to a high extreme we call it eclampsia. So in pregnancy you find that a mother can, it could be a new onset hypertension or blood pressure in pregnancy, or you could find that the mother was having high blood pressure prior to the pregnancy. So if they were having high blood pressure prior to the pregnancy, we call that pregnancy aggravated hypertension. And then we also have pregnancy-induced hypertension. So preeclampsia usually is either of those two. And some of the causes or what can predispose a mother to getting preeclampsia or pregnancy-induced hypertension is one age. So ages between 35 to 45 there are risk factors. And a nulliparous woman, that is a woman who's giving birth for the first time, so a first pregnancy, and then carrying multiple pregnancy, that is a multiple gestation, sorry, that is a twin pregnancy, and then also change of paternity. So you find that maybe she's delivered before and then now the paternity has changed. Yeah, so that also can cause. And then if they're having pre-existing conditions like kidney disease, hypertension, diabetes, all those are also risk factors. Things like race as well is more in black women. Yeah, so those are some of the risk factors that predispose one to getting hypertension in pregnancy.
And what danger does high blood pressure in a pregnant woman maybe how dangerous or how risky is it to the baby and the expectant woman?
So when you're having high blood pressure in pregnancy, first of all, pregnancy by itself, it's a high risk state for the mother, and then now you're coming in to bring high blood pressure. So when, first of all, to the child, a mother who's carrying a pregnancy and the hypertensive, the children they deliver or the children they're carrying tend to have, the growth rate is very small. There's something we call intrauterine growth restriction. So you find that now once you carry this pregnancy to term, or when you deliver, the baby is found to be preterm, is found to have low birth weight. Yeah, so some of the things or some of the consequences of to the baby, usually it's you preterm, the baby is usually a preterm, or they have low birth weight, or they have the growth restriction, so they're usually very small for gestational age. They could be term. If the mother is lucky enough, they can carry the pregnancy to term, and if now after delivery you find that the baby is quite small. Now to the mother, usually we try to deliver the pregnancy earlier because of the detrimental effects of these pressures, because it can cause end organ damage. It can go all the way to eclampsia, as I had mentioned. Eclampsia now is where you have those symptoms of, you're having the headaches, the blurry vision, the edema, that is swelling of the feet, and you end up even getting convulsions. So because of all that and the end organ damage, to prevent all that and to save the life of the mother and the baby, we try to deliver the pregnancy earlier.
So what is a sign, or what levels, high BP levels, make you determine that this lady has to be induced to give birth? Or is it that any pregnant woman with high blood pressure has to be induced to have an early birth?
Not really. So first of all, for you to call it preeclampsia or pregnancy-induced hypertension, the levels should be above 140/90. And then the other parameters like lab tests, you have to do a urine test, you check the protein level in that urine. So for you, sorry, what was your question?
I was asking that is any pregnant woman who is maybe has been found to be hypertensive has to be induced to give birth so that to keep the child safe?
So not all women, because you find that once you're found to have high blood pressure, the doctor will institute some medications, and usually these medications, they work very well and they're able to keep the pressure at an optimum level. Yeah, so the women who we rush to deliver are those, even despite being on management, the pressures are still shooting high. The baby maybe is not the condition of the baby is not optimum while in the uterus. So it's not all women that we aim to deliver. It's those who are unstable clinically, and the BPs are also they're not optimum or optimized with the drugs.
Thanks a lot, Dr. Elizabeth, for that clarification. My director says it's time to take a break. Actually, I've learned something, that changing paternity can actually predispose you to high blood pressure while you are expectant. We'll be back with more on hypertension and specifically the treatment modalities, preventive measures, and any other pertinent details that you need to know. Stay with us.
We've gone for a break.
Capuchin TV, your Catholic identity.
Welcome to Mater Misericordiae Hospital, Buru Buru Clinic for holistic medical services.
This is Buruburu Medical Center, which is part of Mater Hospital. And at Buruburu, we essentially offer services offered in Mater Hospital.
We are located in the first floor failing building above Quick Mart. In Buruburu, we have general consultation Monday to Friday. Saturday and Sunday they are still available. We still have specialists. On Tuesday and Thursday we have gynecology clinics running from 8 a.m. to 2 p.m. We have a pediatrician clinic running on Wednesday at 8 a.m. to 2 p.m. We normally have a wellness, which we normally do from Monday to Sunday. Every day, feel welcome, you can come.
Experience the difference in our wide range of quality, responsive and compassionate healthcare services.
We have very highly skilled and qualified staff running the units. We offer services including doctor's consultation services, which is the general doctor in the outpatient unit. We also have laboratory services and pharmacy services. On particular days of the week, we have specialized clinics, which include the physician clinic, where we have our hypertension and diabetes patients followed up. And then we also have the obstetric gynecology clinic, which is run on Tuesdays and on Thursdays. We have the pediatric clinic, which is run on Wednesdays. And then we also have the ENT clinic, where we have the ENT doctor coming in, and that is run on Fridays in the morning. There is also a pediatric surgery clinic, which is also on Fridays.
Our child welfare, we normally do them on Wednesday, Friday, and Saturday from 8 a.m. to 2 p.m. We have our ENT clinic Friday, 8 a.m. to 10 a.m. We normally have nutrition services on Tuesday to Thursday, and we have extended our radiology services from Monday to Friday to Saturday nowadays. Initially, we were running up to Friday, but currently going up to Saturday.
We deliver all our services with utmost diligence, integrity and equality.
We see everyone at the Buruburu branch. We do not discriminate against anyone, either on race, on religious grounds, or disabled people. You are all welcome to receive services at our branch.
Be assured of privacy. We normally keep to our ethics. We are so compassionate to our clients. Integrity is all over. So when you come, we feel you, and that is why you can see nowadays we are running, like every Friday we are having a special clinic. Currently we are running the breast clinic. Next month we are coming up with clear colon screening. So don't forget we are Christ-centered. When you come, and we don't segregate because you are a Christian or a Muslim or Hindu. We treat every client as equal as any other.
Capuchin TV, your Catholic identity.
Welcome back, dear viewer, and thank you so much for keeping tabs with us here on Capuchin TV. We are bringing you this live discourse, health discourse, live from our headquarters in Karen, along discussing the topic hypertension. As usual, every Friday is a health Friday, and we make sure that we interact with you, bringing experts to make sure that they enlighten you on important details about different medical conditions and healthy lifestyles. So with me in studio is Dr. Elizabeth Warui. Welcome back to our second session.
Thank you so much.
All right, so keep your questions coming. The first session, we're just trying to understand the concept of hypertension, the signs and symptoms, the risk factors that predispose one to this condition, and other details. So right now, we'd like to move forward and try to understand how is this medical condition diagnosed.
So in diagnosis, usually you want the patient to go to a hospital so that they're able to be done for the blood pressure monitoring or the blood pressure check. So there are guidelines on how to measure the blood pressure. So ideally the patient should be sat down for 3 to 5 minutes, and then they should be leaning. The back should have a support, and also the arm should also have a support on the table. And then when measuring the BPs, at least do 1 to 2 readings, 2 to 3 minutes apart, and get an average of that. So for you to diagnose hypertension or high blood pressure, it all depends on the accurate measurement of the blood pressure. So usually follow the guidelines on how to measure the BP. And now, depending on the value you get, it's now when you're able to gauge this person. Are they having normal BP? Are they having pre-hypertension or stage 1 or up to stage 3 of hypertension? Yeah, so the diagnosis is mainly on measuring the blood pressure. Yeah.
Thank you. Now, in terms of treatment, what kind of modalities are available for patients with hypertension?
So in treatment or in management of hypertension, usually there's lifestyle management and there's pharmacologic management. That is pharmacologic and non-pharmacologic. So I'll start with the lifestyle or the non-pharmacologic management. So this involves changing basically your lifestyle modification. So it involves things like losing weight for people who are overweight or for people who are obese, trying to be more physically active, stress, finding healthy ways of managing the stress, eating healthy food or healthy diet. And by diet, this will include food that is less in salt, food that is less in fats, mostly saturated fats. Also trying to eat foods that have more of potassium, more vitamin D, and more fruits and vegetables. Yes, so that is for the non-pharmacologic treatment. The pharmacologic treatment, or what now the doctor will offer you, the drugs, we have so many different drugs that one can be given. There are things like calcium channel blockers, we have diuretics, what we call the water pills, we have thiazide. There are so many different types of drugs that a doctor can give you. So basically when you're talking about management, you need both together. So lifestyle management and medication, but usually it depends also with the level of the blood pressure, because if it's not again too high, the doctor will assess and see this is someone who just needs lifestyle management. So they'll just advise you on what to do without giving the medication. So maybe for a period of 3 to 6 months, your doctor will tell you go home and monitor your pressure. And while you're monitoring, be physically active, try and lose some weight, diet-wise check what you're eating, and within that period, if there are changes in your lifestyle, and now the doctor assesses and sees that the pressure has gone down, they'll see there's no need for pharmacologic treatment. But if the pressure is still high, even after doing lifestyle modification, then now you have to do both of them together synergistically. Yes.
Is the treatment administered to other patients the same as the one administered to expectant women with high BP?
The treatment is different, given that now we try to give treatment that are safe in pregnancy, something that won't cross the placenta, and if it does cause, there will be no detrimental effects to the baby. So there are specific antihypertensives that are given to pregnant women, which are different from what you give to a non-pregnant woman or to to other people. Yeah.
Thank you. Now, now that hypertension is mostly asymptomatic and it's not easy to tell at the early stages, what health practices would you recommend for people, young and old, to adopt in order to be safe from high BP?
Yeah. So this
or to maintain a healthy level of BP.
Yeah. So it cannot be emphasized enough, and it's usually mentioned time to time and again, and people will think it's more of a cliche, but usually it's just that physical inactivity definitely is a cause. So try and be more physically active. Try and be someone who walks or jogs or runs. So physical inactivity is a huge cause. So try and avoid that. And then in terms of diet, as I had mentioned earlier, try and eat food that is less in salt, less in saturated fats. Do more vegetables, do more fruits, also bananas because they have potassium, more vitamin D, so even going outside to get some vitamin D is good, or even supplementing in your diet. Yeah, so practices mainly physical activity, so exercise. If you're overweight or obese, try and lose some weight. Diet, watch it very carefully. And also, sorry, I forgot to mention tobacco smoking. So someone who smokes tobacco, that one needs to stop. And alcohol, at least reduce the level to minimum levels. Yeah.
So smoking can also cause the risk of contracting or having high blood pressure?
Definitely, it's a major cause, and in the world you find that 7 million people, I think that is in the year 2020, died out of complications of smoking tobacco. Yeah, and 6 million of this was through direct smoking, and 1 million was through passive smoking. So you may not say you're a smoker, but you have someone who smokes in the family. That smoke will affect you indirectly. So yes, passive smoking. So it's a huge cause.
Thank you. Now, what can be done, or maybe before we get to that, because it's a general question that applies within and across borders. How long does it take to heal? Can someone heal completely, like get their blood level to normal, blood pressure levels?
So, one, yes, and also no, because high blood pressure is a lifelong disease. It's those diseases like diabetes, which is regarded as lifelong, but with correct lifestyle modification. In terms of consistency, continuous follow-up with your doctor, you find that people whose BP tend to normalize. But what I advise patients is never stop taking medication on your own discretion. It's always good and important to see a doctor. The doctor will be able to taper down whatever it is you're using, and if they see there's need now for you to now do lifestyle modification by itself without the drug, it should all come from the doctor. So usually it's a lifelong disease, and the medication you're given should be taken as for a lifelong period, and never stop taking medication just because you feel like your BP is fine or because you're not having symptoms, because that pressure is only normal because you're on medication. And the moment you stop using the medication, it goes back to being high. Because I've had so many patients who come to me and tell me, I stopped using the medication because I felt I'm okay, or I've taken my pressure severally for 2-3 months and I find it's fine, so I thought then I'm okay. So that pressure is only okay, or it's only normal because you're on medication. The moment you stop using the medication, it goes up. It shoots up to where it was. So it's always advised to get the discretion of a doctor in terms of tapering down the medication, or in terms of being weaned off completely from the medication. Yeah.
So what are there some other diseases that that high BP can lead to?
Yes, definitely. High blood pressure is a major cause of many health complications, including complications in the heart. This can be myocardial infarction, you can get heart failure, you can get arrhythmias, those are abnormal heart rhythms, and even death. To the brain, you can get a stroke, and this stroke can be an infarctive stroke caused by a clot, and it can be a hemorrhagic stroke caused by bleeding. Yeah, and and in severe cases, you can also get kidney diseases, and in severe cases, there's death.
Okay, we have someone here asking, is stress a contributor to high blood pressure?
Yes, stress is a major cause of high blood pressure. There's a huge there's a huge, let me call it pathophysiology or pathway of how stress will cause high blood pressure in terms of how it affects the nerves, how it causes vasoconstriction of blood vessels, and in that you end up having high blood pressure. So stress is a major cause, and that's why you need to find healthier ways of dealing with the stress and trying to even cancel it out completely. Yeah, so stress is a major cause of high blood pressure.
All right, I hope, Monica, you got your question answered. And generally, what can be done? When we started, you mentioned about the need to, there's not enough awareness about high blood pressure or hypertension among the public. So what can be done to redress this situation and probably flatten that curve of blood pressure, considering that yes, it affects all age brackets, all age groups, and all populations?
So I think the best thing is just through what we're doing, creating public awareness through health advocacy, and also WHO has also, it has a target to reduce high blood pressure by 33% come the year 2030. So it's a global target for non-communicable diseases by WHO to reduce these levels, and this is through creating awareness, treating those who already have the pressure, trying to control it. So there are already measures in place, and also at the grassroots levels now, us as health practitioners or as medics, trying to create more awareness to our patients, and also through what we are doing also is a way of creating awareness. Yeah.
Thank you. There's a question from Oskin. He's saying he's watching from Kikuyu and he's asking, do I really need to take drugs? Or is there anything else you can do to control my pressure? Then he's also asking, will I ever stop taking drugs? So basically he wants to know how long will it take for them to heal? Will they stop at some point? Will they stop using or in taking the drugs?
So as I mentioned earlier, hypertension or high blood pressure is a lifelong disease. So usually the medication the doctor puts you on, you should be psychologically prepared that you will use them for a lifetime, not unless now the doctor assesses you. And this is done continuously and consistently, over a period of, let me say, several years. So it's not just all of a sudden the doctor decides to just put you off the medication, not unless the patient is having secondary hypertension, where you've been able to identify the cause, maybe thyroid disease, maybe kidney disease, maybe it's a drug they were using. So once you identify the cause and you eliminate the cause, then it means your pressure will also now come down. So if you're able to identify the cause, then definitely you will treat the hypertension. So the doctor will be able to taper down your drugs, and completely you can also be weaned off from the medication. But now in the case of primary hypertension, the risk factors are the main contributing factors. So if you're able again to work on them, if you're able to work on your diet completely, you work on your weight, you stop the tobacco smoking, you reduce the alcohol intake, the drug will be tapered down and the doctor will assess. But usually it's good to understand that this is a lifelong disease that needs lifelong care with the medication. Yeah.
That's aptly put, and of course it's in-depth details about your question. Oskin Gankoi, thanks for watching and thanks for your questions. Time is against us, but remember, you can still keep your questions, especially questions and concerns on medical conditions coming. If you wish to, you do not wish to reveal your identity, you can always opt for our number, which is 0717-424866. You can send an SMS, WhatsApp, or just call. So right now, at this point, I would like to allow our guest to give us her concluding remarks as we close the discussion. Elizabeth.
All right. Thank you so much, Elizabeth, for letting me come here, for giving me a platform to discuss about hypertension and to create awareness. So I'm hoping after this, people will be able to take it upon their own account to see a doctor, be assessed, and be able to know where they lie health-wise and also in terms of their BP. So I'd also like to add that where I work at Mata Karen, at the Well, we're having a free medical camp that will be running from 25th, 26th and 27th. So what services we'll be offering are free medical checkups. We'll be doing weight monitoring. We'll check your height. We'll calculate your BMI. We'll also have a free nutritional there will be a nutritionist who will offer free nutritional advice. So you're all invited to come to Mata Karen branch, which is at the Well, opposite the parish along Langata Karen Road. So yes, all are welcome.
So everyone is welcome?
Everyone is welcome.
Open to all?
Open to all.
Great.
Yes.
So all these procedures will be done, is it just the diagnosis stage?
Is it just?
The testing, the tests and diagnosis that are done for free?
Everything, okay, what I mentioned is there's height and weight, which will calculate your BMI, so there's BMI monitoring. There's also free sugar test will also be done, free monitoring of BPs, and if there's anything in terms of nutritional advice, it will also be offered. There will also be a doctor who will offer consultation.
For those who have inquiries, is there any contact that they can call or send an email to make inquiries?
So what we have in our banner here, there is a contact down here. Yeah, so the number is 0732 163 650. 0732 163 650. So in case of any inquiries or any more added information, you can contact that number.
All right.
Yeah.
That's clear, and save the date and the time, so that will be a free medical camp at Mata Misericordiae Hospital, Karen branch, right?
Karen branch, the Well.
Okay, Karen branch at the Well Mall, along, is it Karen Langata Road?
Yes.
Yeah, Karen Langata Road. All right, thank you, dear viewer, for being with us since we started, and now it's about time we close the discussion. Thank you for your participation. Thank you for your feedback, and we'll keep this going on next Friday. Our camera operator has been Anthony Similio, and assisted by Franklin, and on the other side of the gallery we have Eric Otieno. We have Eric Otieno operating the sound desk, assisted by Jessica, and we also have our visual mixer, our able Michael Ndegwa, and on the transmission chamber we have Michael Kibandi. Thank you so much for your time. My name is Sasha Elizabeth. See you next time. Have a great weekend. Goodbye.
Are we done?
Capuchin TV, your Catholic identity.
Mata Hospital welcomes you to its newest satellite medical center at the Well Mall along Langata Road in Karen.
The reason why clients should come to Mata Karen Clinic or Medical Center is because we offer a variety of medical services, to include consultation services which are done by our qualified and experienced doctors.
We manifest the Spirit of Christ in the provision of healthcare to all our patients as we adhere to the values of the Religious Sisters of Mercy.
We provide basically primary healthcare services. So this means we'll follow up patients on an outpatient basis for various diseases, including diabetes, asthma, and any other illness which arises, which does not require complex care. Our staff are qualified and provide effective services which are cost effective and good for our patients.
The various services that we offer at our clinic include pharmacy services, where we have a fully stocked pharmacy run by a qualified pharmacist, and we serve all your prescription needs. We have laboratory services that are run by our qualified lab technologists.
Get more than just basic treatment at Mater Hospital Karen Medical Clinic.
One of the key features of primary care is that we provide health education about various conditions. This would include things like hypertension. We would advise you on things such as how to take care of your health.
We serve our clients within a very short time. We have enough well-ventilated waiting area for our clients. And we have rooms for all those procedures that we've mentioned, well-spaced rooms with enough facilities and equipment. We also have all the decentralized services that are offered from the main hospital, to include ultrasound services that we offer on Wednesdays from 8 a.m. to 5 p.m. in the evening. So feel welcome to Mater Misericordiae Hospital, Karen Medical Center.
We take pride in your wholesome well-being. We are always ready to meet you at your point of need.
A lot of health issues are now preventable, and this means that just by making lifestyle changes, we can improve the health of people in the community.
Our esteemed clients and patients, welcome to the Mater Misericordiae Hospital, Karen Medical Center.
We have a large, well-ventilated facility, which means that we are able to see patients in a safe environment. And I would ask you, if you have a health issue and you are within the area, please feel free to come and consult us. We're happy to work with you and identify your issue and resolve it.
We are open every Monday to Friday from 8 a.m. to 7 p.m. and every Saturday from 8 a.m. to 5 p.m.
You come and support us in this medical clinic in Karen, in the well. We are in the first floor. And you just test us. Sisters of Mercy are known for quality because they are all over the world, and especially our care for the sick. It is hard times because of the coronavirus, but we know we will give the best quality.
We just want to welcome all of you to come to our gynae clinic. It runs every Tuesday from 9 to midday. We have the full gynae specialty, all located in one room, one roof. We have a very comprehensive lab. We have ultrasound services, and most of all, we have caring staff who are going to take care of all your needs. So once again, welcome and karibu to this great medical center of ours.